Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former compensation and pension examiner. Today, I want to come on and discuss carpal tunnel syndrome and how that can be related to VA disability. Carpal tunnel syndrome is a super common condition. It affects veterans, service members, non-veterans, just the regular human population, right? So let's dig in and talk about what carpal tunnel syndrome is first, so we can get a better understanding of what we're talking about. So the Mayo Clinic discusses carpal tunnel syndrome and says that it is one of the most common hand conditions. It is caused by pressure on the median nerve. This is the median nerve runs through the front part of your wrist here. And the carpal tunnel is a narrow passageway surrounded by bones and ligaments on the palm side of the hand. When the median nerve is compressed, symptoms can include numbness, tingling, and weakness in the thumb and fingers. So when this carpal tunnel, right, this tunnel that has all these nerves and ligaments that run through it is compressed and pushed on, it can affect that nerve and cause some symptoms, okay? So Mayo Clinic says that wrist anatomy, health conditions, and possibly repetitive hand motions can contribute to carpal tunnel syndrome. Some of the symptoms include tingling and numbness. Usually these symptoms can start gradually and can progressively become worse, or maybe they just stay, pretty constant, right? But tingling and numbness can occur in the fingers. So those nerves distribute to your entire hand and your fingers, right? So if it's being pushed on here, think about a hose, right? If I have a hose and I kink it right here, it's going to affect the hose downstream, right? So your hand is, your median nerve is getting pushed on, and it's going to affect your sensation potentially and the fingers that nerve distributes to, okay? So usually that's going to be your thumb, index, and middle finger. Okay. There's a different nerve that feeds this side of the hand and then the back of the hand. Okay. So the front side of those first three fingers, right? Yes. So it says the thumb, index, and middle finger and ring finger can also be affected, but not the little finger. You might have a feeling like an electric shock in these fingers. These symptoms often occur while holding a steering wheel, a phone, a newspaper, or they may wake you up from sleep. It can also travel from the wrist up the arm. Many people try to shake it out to relieve their symptoms. You can also develop weakness. So that's pretty much it from the Mayo Clinic. So some of the causes, let's talk about what they say some of the causes are, and then we're going to jump into the veteran side. So some of the causes, it can be, again, that pressure on the median nerve. The median nerve runs from the forearm through a passageway in the wrist and the hand known as the carpal tunnel. So that carpal tunnel gets compressed. The median nerve provides sensation to the palm side of the hand and all of the fingers except for the little finger. This nerve also provides signals to move muscles around the base of the thumb. Anything that can squeeze on or irritate the median nerve in the carpal tunnel space can lead to it. So if you get a fracture in there and it presses on that nerve, if I stab you in the wrist, right? If you break glass and sever it or damage that nerve. A wrist fracture, like I said, can narrow the space in there, especially if there's inflammation or like bone pieces that move around. Chronic inflammation. So we see that a lot in people that have things like diabetes, and we're going to talk about that here in a second as well. So risk factors. So anatomic risk factors, we talked about that, just compression in that space. A wrist fracture or dislocation. More common in women, this article says. Nerve damaging conditions like diabetes increase the risk of nerve damage. Inflammatory conditions like rheumatoid arthritis, gout, other conditions, medicines. There are some medications that are linked. Obesity, that's a big one. We're going to talk about that here shortly. Thyroid disorders, kidney failure, workplace factors. So that's a big one. So working with vibrating tools or on an assembly line that requires repeated movement that flex the wrist can create pressure on that median nerve. Such work may also worsen existing nerve damage. All right, so that's it for the Mayo Clinic. So let's talk about how it can be related to service. So it can be related on a primary or secondary basis. So primarily, if you're diagnosed with it in service, if you entered service, didn't have carpal tunnel, didn't have any risk issues, right? You developed carpal tunnel while on active duty. Maybe you injured yourself on active duty and maybe it just developed insidiously. And it's continuing after service, and you can show that it was developed while on active duty, you might be able to get service connected for it. If it's related on a secondary basis, let's say you're service connected for another medical condition that has led to the carpal tunnel or has aggravated it or worsened it, that can also be a consideration, right? So diabetes, like we mentioned, rheumatoid arthritis. Let's say you have a wrist fracture from service, and then many years later, you develop carpal tunnel syndrome, okay? Another thing is obesity. So that's a big one, right? So obesity as an intermediate step, we talk about that all the time. So I have a couple articles to just riff off for you here. Hang on one second. Just about obesity and carpal tunnel, right? You can maybe talk to your doctor about it and see if they think that this may be related or possibly a cause. So hang on one second. 2022 article, okay? Weight-related and personal risk factors of carpal tunnel syndrome in the Northern Finland birth cohort, 1966, published in the Journal of Clinical Medicine. This was published in 2022, right? It was just talking about a birth cohort of 1966. So people that were born in that year, maybe they're in their, 60s, 70s, whatever. 50s, 60s, whatever, whenever this was published. It discusses the risk factors for carpal tunnel syndrome, including obesity and being overweight. The research further discovered that BMI, body mass index, is a greater predictor of carpal tunnel than waist circumference. Another article, let's see, the concept of correlation between weight and carpal tunnel has long been observed in medical research. 1997 article, a case control study of obesity as a risk factor for carpal tunnel syndrome in a population of 600 patients, presenting the independent medical evaluation published in the Journal of Hand Surgery, examined the BMI of 300 patients with electrodiagnostic evidence of carpal tunnel syndrome. So that means on EMG, they had positive carpal tunnel, right? Found that there was a significant association between carpal tunnel syndrome and obesity. Okay. So those are just a couple articles. Let's talk about the ratings real quick, because I know you guys like to hear about the ratings. So ratings are always subject to change. Always best to follow up with an accredited claims agent, an attorney, or a VSO on this stuff, because I am not an expert on ratings. But this stuff, you can research it. The 38 Code of Federal Regulation, like I said, you want to always consult with a VSO if you're not sure. But 10% if you have incomplete mild paralysis. You can get 20 or 30% for incomplete paralysis moderate. Now, of course, this is going to be whether you've got one side or both sides, right? 40/50% for incomplete paralysis severe. And you can get 60 or 70% if you have complete paralysis marked by absence of flexion of the index finger and not very good flexion of the middle finger, inability to make a fist, index and middle fingers remain extended, inability to flex distal phalanx of the thumb, and weakened flexion. Okay, so I hope this was helpful to you guys. If you have any questions, drop some comments. And as always, thank you for watching.